Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding.
You know, we all think we know what insomnia is, right? It's that awful night where you're just tossing and turning. But what if I told you that in just the last few years, our entire scientific understanding of insomnia has been completely flipped on its head? Let's dive into the new science that is totally reframing this thing we thought we knew.
And this is the central question that's changing everything. For decades, insomnia was pretty much seen as a side effect of something else, like anxiety or depression. But the latest science is telling us, hang on, maybe we've been looking at this completely backwards. This one shift in perspective is changing everything about how we diagnose and treat it.
So to really get where we are now, we kind of have to look at where we've been. Insomnia is by far the most common sleep disorder out there. But for years, the way we actually diagnosed it was, well, it was a mess. Let me show you what I'm talking about.
Okay, so under the old system, doctors were stuck with this tangled mess of terms. Was the insomnia primary, meaning it was the main problem, or was it secondary, just a symptom of something else? They even had all these confusing subtypes like psychophysiological. The real issue was that it was basically impossible to tell what was causing what, and the definitions were so unreliable. It was a nightmare for doctors and honestly super frustrating for patients.
Thankfully, that's all in the past. The two giants of medical classification, the DSM-5 and the ICSD-3, you might have heard of them. They both adopted a huge breakthrough. They created one clear, unified, and consistent way to diagnose insomnia.
Just look at how much simpler this is. It's night and day, right? On the left, you've got that old, complicated view. And on the right, the new one. They swept away all those confusing subtypes and replaced them with a single, clear diagnosis: Insomnia Disorder. That's it. It's clean, it's consistent, and it works for kids and adults alike.
So to get diagnosed with insomnia disorder, the rules are really specific and easy to remember. You're having trouble sleeping at least 3 times a week, it's been going on for at least 3 months, and this is happening even when you have plenty of time and opportunity to sleep. That simple rule of thumb, 3 times a week for 3 months, makes the diagnosis so much more reliable. And this isn't just about shuffling words around. A reliable diagnosis is the absolute first step to getting treatment that actually works. When doctors and patients are all speaking the same language, it's way easier to figure out who needs help and make sure they get the right kind of support.
So, with this new clarity came something else, something that came into really sharp focus. And that's the truly serious, long-term health risks of chronic insomnia. We're talking about way more than just feeling tired.
The evidence is just overwhelming now. There are studies that have followed people for years, and they show a really strong link between having insomnia and developing depression later on. It's also tied to an increased risk for heart disease, and even a higher risk of mortality. The stakes are just so much higher than we ever thought.
And researchers have gotten even more specific. They've identified a particular high-risk group. It's got a technical name, the insomnia with short sleep phenotype. But all that really means is a group of people with a specific set of characteristics. These are people who don't just feel like they can't sleep, but when you measure them in a sleep lab, they are objectively getting very little sleep.
And for this specific group, the health risks are severe. I mean, look at this. We're talking about a clear, documented link to high blood pressure, type 2 diabetes, real, measurable problems with brain function, and, like we said, an increased risk of mortality. This is not just some minor annoyance. It is a serious medical condition.
Okay, so if the risks are that serious, how do we treat it? Well, this is another area where the science has just taken a massive leap. Because the #1 gold standard treatment isn't a sleeping pill anymore. It's a type of therapy.
The whole philosophy has changed. Instead of just trying to drug the symptom into submission, the focus is now on actually giving patients the skills, both cognitive and behavioral, to manage their own sleep for good. It's a much more active and empowering way to approach it.
This amazing approach is called Cognitive Behavioural Therapy for Insomnia, or CBT-I, and it's a very structured process. First, you basically become a detective of your own sleep, figuring out your unique patterns. Then, you learn to challenge all those anxious, harmful thoughts that keep you awake. You know, that one bad night will ruin my whole week kind of thinking? Next, you start tweaking your daily routines and behaviors. And finally, you pull it all together to build healthy habits that actually last.
And get this, look how powerful it is. This quote here points out that CBT-I works great even for patients with other really serious mental health conditions like depression or PTSD.
It turns out that by treating the insomnia directly, you can see huge benefits across the board, even in these really complex cases. You're treating the root of the problem.
Now, this new way of thinking isn't just happening in a bubble or in individual doctors' offices. It's actually part of a much bigger shift, a move toward finally recognizing sleep as a critical piece of our public health.
For the first time ever, huge organizations like the National Sleep Foundation are putting out official guidelines on how much sleep we all need. National health goals now include specific objectives about sleep. The big idea here is to finally stop seeing sleep as some kind of luxury and start treating it as a core pillar of health, right up here with diet and exercise.
Which brings us to this final question. We now know insomnia is a real medical disorder. We know it has serious consequences, but we also know it's highly treatable. So if sleep really is a fundamental pillar of our health, both for us as individuals and as a society, the question becomes, what are we going to do to make that foundation stronger?
Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.